Good afternoon, dear ladies and gentlemen. Good afternoon, dear friends and colleagues. This is a very, very special meeting, and have a nice afternoon here from Vienna, from the Vienna studio. My name is Wolf-Dieter Baumgartner. I'm leading the hearing group at the moment, and I want to welcome you to this very, very special meeting. For the very first time ever, we will discuss the World Hearing Report, and I'm especially happy to have our special guest, Dr. Shaili Jada from the World Health Organization in Geneva. And we have a wonderful group of experts to discuss all the hearing issues at the moment all over the world. We should not forget there are also other diseases still out than COVID or corona disease. Hearing is a global network. We founded 2008, so it's now 13 years, and it's 13 years and 31 centers from all over the world. The first chairman of the hearing group was Professor Paul van der Heining, and I have the honor to be the second one since 4 years now. Here you see some members of the hearing group. Usually we have an annual physical meeting, but because of COVID, we decided already last year to do some more meetings, and now we do one quarterly. So this is now our 4th meeting in the COVID era, in the COVID time. And you see here some people from our last meeting in Raleigh, North Carolina, but this is now already over 1.5 years ago. This was in October 2019. Who are we? We are, we call ourselves world-leading experts dedicating to hearing implants, to basic research, clinicians, audiologists, speech therapists, surgeons, so all people who are dealing with hearing, and we try to define and to set the standards in therapy actually since the year 2008. We do frequently publications in peer-reviewed papers, and we published already quite some papers concerning innovation of hearing implants, educating people. We have a wonderful education program. We have exchange program to visit our departments or clinics, to be comprehensive and also coactive. We work together in collaborations, and we want to bring the world and our patients and the science forward in a world for better hearing. We still think, we don't only think, we know, and we will hear this in the next talk, that the hearing impairment is still underestimated and it is still undertreated. And this is a big mistake and a disadvantage for millions and hundreds of millions of people. So we have a lot of guidelines, quality standards in hearing aids, quality standards in cochlear implant, in implantable hearing aids. Now, what is this meeting for? This meeting should bring the focus for the worldwide hearing intention to bring the topic forward in hearing implants and in therapy. And I'm very thankful that Professor Javier Gavilan will moderate this expert meeting. And now our journey will leave for the moment Vienna, where our wonderful studios. So we'll start our world tour through Spain, Argentina, Africa, India, Albania, and twice Switzerland. And now let's start with Professor Javier Gavilan, University Professor of the University Clinic in Madrid, La Paz. Yes, hello, Javier, can you hear me? Professor Gavilan?
How are you, Baumi?
Very good. Very good. I'm sorry for Real Madrid last night, but we will discuss another topic today, and we await your moderation, and I'm very thankful for all the people. I see now 316 people online right now. Welcome every single person. Thank you for joining us, and we want to do a wonderful and interesting discussion. Please, Javier.
Thank you, Baumi. Hi, everyone. Thank you for joining us for this meeting on the World Health Organization report on hearing. We are going to have a lively discussion. We will have a special guest speaker, and after that we will discuss among the panelists. And I would like to invite you all to participate in this discussion by sending us to the chat your questions, your comments, your suggestions. This meeting will deal mainly with hearing implants. So I know that the World Health Organization, WHO, produced a wide report, but we would like to focus on hearing implants, because this is organized, this is run by the hearing, as Professor Baumgartner already mentioned, and the hearing, as he said, is a web, a net, a complete group of expert centers of hearing implant solutions. So we will deal mainly with this. And we will try to move, therefore, to severe and profound hearing loss. We want this to be a global experience. We want this to include all areas around the world, trying to get involved not only high-income countries, but also middle-income countries, and of course, low-income countries, and have an overall a global experience. To start with this idea of global journey, I would like you to go to the Mentimeter. What is the Mentimeter? The Mentimeter is a tool, it's a device that you can access with your laptops, with your computers, with your phones. And if you go to the web page you see here in your screen, www.menti.com, if you go there with your laptop, with your computer, or with your phone, and enter the code 38044605, the one you have in your slide, you will be able to answer the questions that we will have during this meeting. Maybe it's easier for you to use your camera and get the QR code that it's shown also in the screen. And with this QR code, you can access the Mentimeter. And we will have the first question for this Mentimeter, just to know how global this experience is. So the first question is very easy to answer, is just where are you from? Please put your country of origin in your web page or your phone in the application of Mentimeter, and let us know where are you from right now. We have more than 340 participants, and as you see, it's a huge number for India. The cloud word that is showing in the screen, on the screen, is showing with bigger letters the origin of most participants. So India, Austria, USA, Bangladesh, Canada, Philippines. As you see, this is really a global experience. We are having people from all continents, and we hope that you are enjoying your participation in this meeting. Well, I think we will move, you see, the places where we are coming. Let's move to the second question. What is your profession? You are pathologists, surgeons, ENT, you are a speech therapist, you are audiologists, you are students, you are, what is your field of work in this meeting? Okay, it's amazing. It's a majority of audiologists for the meeting. This is good. We can direct our questions to audiology. And please, could you all mute your microphones, because there are some voices coming in the conference. So if you please mute your microphones, communication will be easier for all of us. Okay, well, you see, there's a lot of students. This is interesting, audiologists and students. So I think we are addressing our meeting to a lot of young people, and that's the future. That's extremely interesting. Okay, so right now, without much more time to do, let's move to the main part of the meeting, which will be starting with a guest talk by our guest speaker, Professor Shelley Chatha. Okay, Shelley Chatha is working at the WHO as medical officer for ear and hearing care. She has a huge experience in policy development for hearing care and has worked in the National Program for Prevention and Control of Deafness in India. But before being in the heaven of health system, she was on the earth of medical practice, working as professor of otolaryngology in New Delhi, in India. We are really honored to have Professor Shelley Chatha as our special guest speaker. And she will give us a 15 minutes talk on hearing care for all, the World Report on Hearing. Shelley, please.
Yeah, thank you, Professor Gavilan, and it's a pleasure to be here. So I will need to start my talk with an apology because despite all our mastery over technology, it seems that we are failing to provide captioning because of some technical hitches on the captioner's side. So firstly, I have to apologize to all of those who joined with the expectation of it being accessible through captioning. And I know that the organizers are trying their best to fix it as soon as possible. So let me start with first by saying that. So let me talk today, and let me start by taking you on a journey into the year 2050. The year 2050, by which there will be nearly 10 billion of us inhabiting this planet. And if our predictions are to come true, nearly a quarter of them will have some degree of hearing loss, mild to profound or complete hearing loss. 2050, for those of us who live that long, the world may well be a different place, a world with robotics, artificial intelligence, part of our daily lives, where virtual reality is the norm and self-driven cars are, well, all around the place. A world in which hearing technology would have made significant more progresses. There would be better implants, newer technologies to assist, and we would not fail to provide simple technology like captioning and so on. But my question to you today all is that what would this mean? What would this mean for this mother who sits in rural Rajasthan in the western part of India, waiting for her 2-year-old child to start speaking, wondering why he is not speaking like the other children, not realizing that he really cannot hear anything? What would it mean for this grandfather whose family is upset with him because he forgot the plans they made for the day, whereas the fact is that he never even heard those plans? So for technology, for all of those advances that we make on the technological front, on the clinical front, for them to make a difference in the lives of these people, of real people, we need something more. We need public health action, because it is only when clinical and technological advances are combined with public health action that the vision of hearing care for all can be realized. And it is this vision, as well as this public health approach, which is concretized, which is explained in the World Report on Hearing, which talks really about, it's a simple report. It talks about why hearing care is important and how can hearing care be provided to all those who need it. So what this report shows us is, it shows us that hearing loss is on the rise, that currently about 1.5 billion people have hearing loss, and nearly a third of them require hearing rehabilitation services, and that this number is growing to grow massively. By the year 2050, there could be 2.5 billion people with hearing loss, with over 700 million requiring hearing rehabilitation services. And while a lot of this rise is driven by demographic factors, we cannot ignore that risk factors are on the rise and are persisting as well. Risk factors such as listening to loud sounds, entirely preventable, entirely avoidable. But over 1 billion young people today are at risk of hearing loss simply because of the way they are experiencing music. Also, simple infections, ear infections, which have been around for a long, long time, but they persist and even now affect as many as 200 million people globally, leading to hearing loss as well as to other life-threatening complications. What is more is that majority, the vast majority, over 80% of those who have hearing loss, they live in low and middle income countries of the world where services and human resources for ear and hearing care are commonly lacking. What we studied in this report, one indicator, which was just one tracer indicator to assess what is the gap in services like. And we found that only about 17% of those who could potentially benefit with the use of hearing technology actually use it. And this gap varies from, 75% in high income countries to over 90% in low and middle income countries. And this gap comes at a high cost. It comes at a high cost to the individuals who have hearing loss, as well as to the society, because the world is actually losing nearly $1 trillion each year due to the loss of productivity, due to the social isolation that is attributed to unaddressed hearing loss. So what this report shows us is, of course, it gives this entire picture of gloom and doom, but it also shows us that hearing across the life course is possible. It is possible through public health action, action that looks at prevention, effective public health strategies and clinical interventions that can prevent the occurrence and progression of hearing loss. In children, for example, nearly 60% of hearing loss is due to preventable causes. Also, through early identification. For those who have hearing loss, early identification is possible. It is possible and needs to be integrated within the public health field so that whether it is children or it is adults, they can receive screening services. They can be identified early using various innovative screening solutions, using even teleaudiology and telemedicine models for remote parts of the world. And then through solutions, through appropriate and timely care, including surgery, including use of hearing technology, including sign language and other means of communication. So all these are possible. And what the World Report does then is to acknowledge the challenges, because of course we have this huge issue of hearing loss, we also have all this plethora, this entire range of solutions which is available to us. But we know that there is a gap because of the various challenges we face. Challenges such as the growing need for hearing care, challenges also at the level of the health system because of lack of policies, human resources, technologies being accessible, available, services for those, because of lack of data and information, because of financing issues, of course. So challenges at the level of the health system. And very importantly, challenges because of the limited knowledge and awareness, literacy related to ear and hearing care within policymakers, within populations, within the even the health workforce. So challenges at all these levels. And very importantly, I would say the challenge of stigma, which we have yet to figure out how to address. So we know that all these challenges exist, which kind of prevent us from achieving our potential. And the report acknowledges these, taking I would say, a problem-solving approach. How can these challenges be addressed? Sharing examples of how they are being addressed in various parts of the world. And then it provides a framework for the way forward through integration of ear and hearing care that is implemented, which is implemented through health systems, so that all people can have access to quality ear and hearing care services within a supportive environment, which is really the vision of universal health coverage. So what the report calls for is that ear and hearing care and all of the interventions for prevention, for identification, for care and rehabilitation must be part of this universal health care. For this, it proposes the framework of integrated people-centered ear and hearing care, where it calls for integration of prioritized hearing interventions. It defines a package of interventions which the countries must look at, must review, must consider in light of their own particular needs, and then deliver them through strengthened health systems. So what the report also does is it outlines what all needs to happen at the level of the health system to strengthen workforce, to make technologies accessible for financing, for policy development, and so on. So it provides this framework. And at the end, it shows that we can scale up ear and hearing care through an additional investment of a mere $1.33 per person per year. And making this investment over a 10-year period can very well benefit over 1.4 billion people globally. It can avert 130 million disability-adjusted life years, and it can bring a return of as much as $16 for every dollar that is invested. And lastly, the report sets a target. It sets a global scale-up target of 20% improvement in the effective coverage of ear and hearing care services by the year 2030. And it defines 3 tracer indicators to monitor this. So it really presents a call for action to its member states, to its partners, to all stakeholders in the field of ear and hearing care. But now comes the tough part, and the tough part was not the writing of the report. The tough part is in its implementation, because its implementation requires a sustained collaborative effort with WHO and other UN agencies playing their role. But really, a small program at WHO really cannot effectively drive the implementation of these recommendations in this report globally without the partnership of governments, without professional bodies like the one here today, without civil society, without private sector. And for this, to further this collaboration and to concretize it, WHO also has developed, and some of you may know about this, the World Hearing Forum, which is a global advocacy alliance of the World Health Organization. So this is what I want to share with you today. And I want to really invite all of you who are here today in this meeting, in this round table, join hands with WHO to act to achieve hearing care for all and to share our vision, which is the vision of a world in which no person experiences hearing loss due to preventable causes, and those who do have hearing loss can achieve their full potential through rehabilitation, through education, through empowerment. For the cost of doing nothing is one that we cannot afford. So I invite you all to look at the report, to read it, and share also your thoughts, your ideas for its implementation with the World Health Organization. And happy to answer any questions subsequently. But back to you, Professor Gavilan.
Thanks so much, Shelley. That was great. I think we will have a lot of time to discuss all your proposals. And before starting with the real discussion, let me bring you another question. Let's turn on Mentimeter again. I want participation from the audience. And this question is more difficult than the one, what's your profession or where are you from? But I want you to rank in this image you have in your application, rank the importance of the following topics in your opinion. You have 5 different problems, general problems. Maybe some of them or most of them have been mentioned by Professor Chatha. Screening adults and adult cochlear implant, screening children and pediatric cochlear implant, bilateral CI is an issue, hearing implants, not just cochlear implants, more hearing implants, and reimbursement. In your country, in your practice, in your surrounding, in your area of influence, what are the importance of each one of these topics? What is the most important goal you would like to have, and what is, out of these 5 options, the one that is less important to all of you? It looks like all of them are important for most of the attendants to this conference, but the fact is that screening children and pediatric CIs is leading, followed by screening adults and adults CI. And then we have reimbursement, hearing implants, not just cochlear implants, more, middle ear implants or ABIs or bone conduction implants. And the idea of bilateral cochlear implant looks the one who has less impact. I don't know if because we are still low down in the scale and we need to grow before thinking about 2 implants. We have to think first, and I totally agree with that. We have to think first on 1 implant rather than 2. Okay, I think this is a clear image of what more than 400 people are considering their priorities in the field of hearing care. And I would like to continue the journey we were on. I will bring you a free journey to the whole world, and we will go to the places where the panelists are coming from. And this is going to be another demonstration of the global experience we want to have today. You will have a full trip around the world, and I promise, no jet lag. Okay, from India to Argentina, from Albania to Morocco, including Europe, we have people from all over the world. And we want to have a lively discussion. So if any one of you want to add something to what the others said, please let me know, and we will go, we'll try to give you the word. So let's start, well, by the one I have closer to me. Morocco is the closest part to Spain, and I would like to start with my good friend Hamid Ben Galem from Casablanca. Professor Ben Galem is an ENT professor at the University of Casablanca, but he is also a member of the executive board of the IFOS. The IFOS is the International Federation of ENT Societies. So he has also a global view of the situation. Let's start by something easy, Hamid. How is the reimbursement of hearing implants? Remember, we want to deal with hearing implants. What is the reimbursement policy of hearing implants in your country? And this is to all of you. To make this more appealing to the audience, try to be short, try to be concise, and please try to be practical. Let's try to avoid big ideas or philosophies that cannot be taken into hand by the audience.
Absolutely. Thanks, my dear Javier. I'm from Morocco. I'm from Africa also, and I have a overview of Africa. And to answer directly to your question, we have a very special experience in Morocco. We started cochlear implantation since now 20 years, and we started with nothing, with only donation, with no reimbursement. And till we spent 5 to 7 years without any reimbursement, any program, any governmental program. And we started to show the results. And we fought with the health ministry and financial ministry and the government. And now we have very clearly 70% of reimbursement of cochlear implants from the government or from the insurance or private insurance or general global Moroccan insurance. And we have we switched from 70% of the population under insurance to 40, and the last week the government signed for global population. And to summarize, 70% of reimbursement.
Great, thanks, Hamid. And yes, Suela, I was going to go to you directly. Let me make a brief introduction. As you, I mean, the audience, you've seen, this is organized by the hearing, and there are 3 hearing members, and there are 3 non-hearing members. I would like to give the word first to our guest, and Suela is a non-hearing member. Suela Salavaci is professor of otorhinolaryngology at the University Hospital Center Mother Teresa in Tirana, in Albania. And she's in the board of and past president of such societies as the Balkan Society of ENT and Head and Neck Surgery, and also the Albanian Society of Otorhinolaryngology and Head and Neck Society. And we are lucky to have you here as one of honorable guest speakers. Go ahead, Suela.
Thank you very much for inviting me. It's a really great honor, and I'm very happy to be together with you today to share some experiences on that, because since many years I'm working and struggling with different governments in Albania about the hearing loss. Since 2002, we started to do some screening programs in newborn children, but always these were based on the private financing organization or in universities projects. Never was financed or funded, getting foundation funds from our government. From 2007, we were trying to struggle with trying to to send every and to work in every kind of things still to the parliaments of Albania, in order to sensitize our government, to sensitize our parliamentary, and we get promises and promises since years. Finally, since 8 months, our government signed an agreement that they will cover all the new screening for newborn screening for 4 maternities, which are, to tell the truth, are the biggest in Albania. And they will cover also only 20 cochlear implants for them. But as I told you, that I have been coordinator of a lot of programs of hearing screening in newborns, in kindergarten children, in primary school, but we don't have data for older patients. We have a prevalence of hearing loss 2 per 1,000 born. So if we do the hearing screening to all Albanian children that were born in 1 year, which are approximately 30,000 per year, we can find 60 children with profound hearing loss. So we are just helping only 20. So you can understand which is our struggling and challenging to work with. But anyway, after a lot of years, we started something, and we have something which is true, and which is our biggest job to do is just in order to put by law, to be protected by law, the ear and the hearing care, and to be integrated in the national health system, which is not still now. And about the reimbursement for the hearing aids or something else, it doesn't exist.
Okay, thank you, Suela. You see that there are big differences in the countries we are from. I would like to move to the other end. I mean, Switzerland is one of the highest income countries in the world, apart from chocolate and banks. You have a lot of resources. And I would like to introduce Professor Gunesh Rajan. Professor Rajan is the co-chief physician at the ENT clinic Lux of Lucerne. And before this, Gunesh worked as professor of otolaryngology and head and neck surgery at the medical school of the University of Western Australia in Perth. So he has the view of 2 different places, but both of them are highly ranked. Gunesh, Suela and Hamid were telling us about the difficulties to start. You are facing the difficulties of reaching excellence. How is the situation, just not for kids, because I think kids are fully covered in Switzerland, but for adults who are the second step of this problem?
Yeah, thank you very much, Javier. It's great to be here. Pleasure to share the views and have this discussion. I guess diving right into it, in Switzerland, where as you said, very privileged. Kids get bilateral implants, neonatal hearing screening is implemented. There's a special disability insurance that takes care of that for the kids. And also in adults, it's pretty good. The adults that require a cochlear implant, they're also covered by the same disability insurance. I think there it's more an issue of the criteria nowadays. Obviously, the various countries have various criteria on when to implant, and but basically for adults in Switzerland, it's quite good. Everyone that needs an implant gets an implant. The question, if the indication is there, then patients can also get bilateral. Adult patients can also get bilateral cochlear implants. Yeah. So from that point of view, as you said, it's a sort of implant paradise in that sense. Yeah.
Good. Thanks, Gunesh. Let's move to the other end of the world again. Let's move to India once again. Professor Ranjith Rajeswaran is from Chennai, and is the Director and Chief Audiologist at the Murphy Institute of Speech and Hearing of Madras ENT Research Foundation. This is one of the most sophisticated centers dealing with hearing care, focused on serving the patients. And you are, Ranjit, you are worldwide known expert on hearing restoration and hearing implants. So how can older adults in need of a cochlear implant or any other hearing implant be provided with this help in your practice?
Well, thank you, Kavilan. Just to give a brief background of the system in India. So India has almost close to little more than 30 states, and health is a state subject. It's not a federal subject. So the federal government gives guidelines, but primarily they cannot do much about interfere in the health matters because it's a state matter completely. And every state have their own health policies, and it is implemented through their own state government policies there. And another important point here is there are two ministries: the Ministry of Health, and there is a Ministry of Social Welfare. Now, the federal government gives cochlear implant through the Ministry of Social Welfare, where all the state governments gives cochlear implant through the Ministry of Health. So just to give a background how the system works in India. Now, to be very precise to the question with respect to the older adults for cochlear implant, the cochlear implants are reimbursed in India for children, and predominantly for children less than 6 years of age, and the federal government reimburses cochlear implant for persons below the age of 12 years. That's the maximum age that a cochlear implant can be reimbursed in India. But especially when it comes to people above the age of 12 or adults or older adults, there is absolutely no reimbursement from the insurance or from the government. The only reimbursement happens is either through CSR activities, the corporate social responsible activities, or through some kind of NGO sponsorships. And in some instances, what has happened is, on a special conditions, there is also a special application which can be sent to the chief minister or the prime minister of the country, where they can grant implants on a case-by-case basis, even for older adults. These are the means where the older people can get a reimbursement for a cochlear implant in the country. Apart from that, most of the cochlear implants in the country, especially the older adults, are self-funded. Because till 2008, I think even the pediatric were self-funded in India. And it's going to take a long time for the government to reimburse the cochlear implant or the insurance to do it. But as of now, a lot of funding agencies, CSR activities, for example, in our own hospital, we have a lot of CSR initiatives where a lot of philanthropists donate cochlear implants. So I think we use those kind of fundings for adults. And what happens, some of the CSR also focus only on children, so they don't want to go on to the adults. So now the thing is, to be very precise, we have a very, very limited reimbursement or funding for adults compared to children. I would say it's less than 1% compared to children reimbursement we have for the adults.
Okay, thanks, Ranjit. And let me ask the last member of this panel, introduce Mario Cernotti, a very good friend of mine from Cordoba, Argentina. Professor Cernotti is one of the most experienced otologists in Latin America, and this is reality. This is not just friendship. His knowledge on the field of oral atrasia is one of the largest in the whole world. Mario is professor at the Catholic University of Cordoba, as well as director of otorhinolaryngology at the Sanatorio Allende of the National University of Cordoba. Hearing is really glad to have Professor Cernotti as one of our active members. And after this introduction, Mario, do you think hearing implants, not just cochlear implants, hearing implants are under-applied in your country, but moreover, in the whole area of Latin America?
Thank you, Javier. And thank you, Shelly, for the report. It's very clear, the report world. It's the same situation in Latin America, because in my opinion and experience, only 20 to 25% of the people who need an implant, no a cochlear implant, hearing aid, or bone conduction devices, have the possibility to have the surgery or the fitting of a hearing aid. The situation in my country is very similar to Africa, to Albania, and to India, because in our country the government has two ministers regarding to the topic of hearing loss, and health ministry and social help ministry. And for example, in a year, we in Argentina put about 700 cochlear implants, and only 20% of these cases are covered by the government. The other is a private insurance or donations. And this is the situation. Really, it's a very bad situation in all Latin America, including countries like Bolivia and Paraguay, where the government doesn't cover any prosthesis.
Okay, Mario, thank you very much for the overview. Now we have a picture of what happens in different parts of the world. And Shelley, this that look like a normal pencil is a magic wand. I grant you 3 wishes. I want 3 practical wishes from you to tell to the more than 400 people that are here right now. I want 1 wish for low-income country, 1 wish for middle-income country, and 1 wish for high-income countries concerning hearing care, practical thing that we, the 400 plus people that are here, can apply tomorrow.
So the wish is directed to the 400 people who are here. What can they do, right?
Right.
Right. So and I would say that 1 wish will suffice. We believe in equity. So across the board, but thank you for giving me 3. I'll give 2 back to you. And that 1 wish really is that professionals in ear and hearing care, as well as civil society, because I see a lot of civil society members here as well, they become advocates for public health action for ear and hearing care, for its integration into the national health systems. Because while it is fantastic, and we see that there is so much happening around the world to improve accessibility and reimbursement to implants in low and middle income countries, not just in high income countries, but what we need is really to take down care to the grassroots level. And that can only happen when hearing care as a system is integrated into the primary healthcare. We are not just a super specialized system or part of health sitting in a tertiary center, being accessible to our patients who manage to reach us, but really ear and hearing care becomes accessible to every child, to every adult in the remotest parts of the world. And for that, we need all of us here to buy into this public health concept and to become advocates. Professionals and the civil society that I see around this in this group today, the 400 odd people, really has the power to motivate the governments, the authorities, and to make that change happen. So,
okay, so
I only use 1 wish, and I'm returning the 2 back to you, Professor Gavilan.
No, say it if you want. Oh, okay. Wait, let's wait and let's discuss about this, and then you give us your next wish. So this is very clear. Bring the patient from the hospitals to the ground, to the primary care. How can you do that in Morocco?
That's what we started to do, because our civilization, our Arabic and African civilization, are a little bit stigmatized by the handicap and the acceptance of the hearing aids, and the awareness of that was very difficult to fight. And we started with the population, with the families. We started with the insurance, the public, the society, and we started to discuss and to explain that the handicap, the hearing handicap, it's absolutely important to take care. And we also use the classification of handicap of WHO, which placed the hearing handicap at the fourth or fifth more intense and worst handicap. And that was our strategy to convince the population, to convince the patient, to convince insurance, government to take care of the hearing aid and to take care of the hearing loss and to provide all the solution we can for the children and also for adults. Perhaps we can discuss about that later.
Sure, we can. But I want now, I would like to know how we give Professor Chadha her wish. She wants us to bring patients from big hospitals, big centers, to primary care. Suela, you go tomorrow to the Minister of Health and you tell him, I want hearing care be taken into primary care, or what can you do?
You know, when you mention the ministry, okay, I'm the enemy of the ministry now, because always writing papers and things. We also represented this problem in our parliamentary, and at the end we succeed, but not for all Albanians. So we still have something to do. But anyway, during these years, we created a group of doctors, nurses, and speech therapists, which are prepared and have accumulated a satisfactory experience in treating this problem. We organized a lot of conferences with pediatricians and family doctors to explain and to give them opportunities to know the problem of the ear and hearings. So I think that we have prepared stuff now, but also we give some lectures with students. I teach in Faculty of Medicine, also on Faculty of Speech Therapies since 20 years. So we are just doing all our best in order to have at least prepared stuff with satisfactory possibilities to work. But I see that only with private financing, only with universities projects, or projects which are financed from other countries, or with donations, we cannot succeed. Our government have to understand that this is a problem, that to pay some money now is you can gain a lot of more for tomorrow, and you'll not have at the end some people with handicap. This is our challenge to make them to understand. But you have to take in your mind that only 4% of the total budget of Albania in a year goes for health. So can you imagine how they can implement different projects, not only for the year, but also for other things? I have done a lot of researches, and I know that for Albanian children, the deafness is the biggest handicap problem, and I compared with different countries, it's also the same like that. I think that we are in a good starting, let's say, after a lot of years. But if I don't see something written, if I don't see that these are included in the national health system, and this is not protected by law like in other countries, it will be difficult, because still we got problems, economic problems and things. Still we have problems on that, but we want to protect, and we want to go on that thing.
Yes, I agree with you, Suela, but we are telling the problems, we are understanding, complaining, but we are not here just to complain. What I want you to be here is to give them, these people here participating in this meeting, to give them things to do. Ranjit, give me something to do. Tell me, go tomorrow and sit down here with just things saying, bring patients to primary care for hearing care. What do I do?
Well, it's a very good question, and it's exactly what many people in India are doing it. Now, the best way to do is to have a cooperative and a collaborative work. So everybody should understand a fundamental concept is when you increase the size of the pie, everybody gets a bigger share. So everybody has to work towards it to increase the size of the pie. So it is just not the audiologist or the ENT or the industry or the government or a CSR, everything. I think there should be a kind of a movement, or I mean, you can't wait for a movement. So you have to go to the ground, you have to go to work in the local area. The best thing is the problems what we face there is, number one is awareness. So in India, if you look at the many districts have a hearing healthcare system well organized here. But of course, it doesn't gone to the village or a hamlet level, but at least we have it. Now, what is more important is like we need to create a very good awareness programs. And this awareness program is very, very important. First, start creating an awareness program. And whatever means of awareness you want to create, it's up to your creativity to target that particular group of population, because the way you create awareness in my city maybe, or my in a village in my district may be different from Rajasthan or West Bengal or somewhere. So that is something you need to create an awareness. And second thing is, once you create an awareness, never feel shy to do publicity about it. So everybody does a lot of work, but they don't do publicity. The publicity has to go on. And third most important thing is create a implantee or a hearing aid user or a parent or a cochlear implantee advocacy group. I think they are the best advocates. So you have to liaise with the patients for advocacy. I think creating an advocacy group is very important. The third and the most important is, now at least start spending 2 days in a month working in a village. So just go to the village, concentrate one village. You go there with you or with your team or whatever it is. Start working in the village. Build a very good awareness system, build a referral system. See, today the problem is, even if you identify, even if the parent identifies, yes, my son has a problem, has a hearing loss, but they don't know where to go. So the referral system has to be in place. So create an awareness about the hearing handicap and the impact of the hearing handicap, hearing loss, and also create an awareness what they should do and where they should go. The biggest challenge here is nobody knows where to go. That's where they missed out. And another bigger challenge that what we are facing is, we have our own deep-rooted cultures. I'm talking about my own place, and I think every place all over the world have their own deep-rooted cultures and the influence of that on this progress. So we have our own deep-rooted cultures. I think targeting that is a very important thing. So don't target hearing alone. If you say this hearing losses, you really need to target the problems, the social stigmas, everything around it. So awareness is one of the most important things. I would urge all the audiologists or the stakeholders in the hearing healthcare, the students, I think you all have to start creating awareness. The more awareness you create, as you have the social media, and that's the first step that we need to really do. And that awareness will definitely pick the brains of the public and also this the government and other people.
Okay, thank you very much, Ranjit. You hit the clue, because all of them want to speak now after you. So let's go first. I think it was Hamid. Hamid, you were the one first, and then the ladies.
I totally agree with Professor Ranjit. I just want to add something. In the best group advocacy is also the patient themselves. And the creation of association of implantees, of hearing aid users, it's very important to show around them, around the family, around the society, their results. And they are certainly really the best advocacy of our cause.
Good. Suela, you wanted to speak also.
Yeah, you know why? Because he reminded me what we have done in these years. Because I volunteered for 3 years to make a screening to first class of Tirana and around, and I screened 16,000 children. And we prepared a lot of leaflets. And we went to the villages of Tirana and to another city perhaps you don't know, to talk with the parents, because our mentality, I mean, is of the Balkan. They want to just to hide the handicap of the thing, or the, if they have a child with a hearing loss or something, they want to hide the problem. Okay, you can work with the people, you can work with the children and with the patients. We have different societies in Albania for deaf children, for speech therapies. We have ENT society, we have the society for audiologists, and also different, different private companies or supporting companies. They are working every time and everything. But I think that the state has to direct the politics, because this is directly under the politics. Okay, we can change things, we can raise, we can prepare a lot of leaflets and a lot of signs and everything. But if we don't see someone to support every day, because it's not of the problem how to solve my problem, how to give this cochlear implant or these hearing aids to some children that I know, that I found somewhere there, because every day we have problems with that thing. So we have to do so. But okay, we work on that, and thank you for reminding that we are doing, and also we're going to we'll continue on that. We never stop.
Great, Suela. Now Shelley and then Mario. Shelley.
Yeah, thank you, Ranjit, and also to Dr. Bangal and to Suela. So just to say that I like to think of this as a paradigm, as a business paradigm. And if you think of it, what we are trying to do is, we have a product. We have ear and hearing care. But what we are trying to do is, we are trying to create a demand. So we really need to think of it from the perspective of creating a demand in the society. So which means creating a demand amongst the consumers themselves, also within the policymakers, and at the same time, so we can't create a demand and then leave it be. We have to be ready to provide those services. And all of the points that you mentioned are extremely important, Ranjit, but I would like to add one more to that, and that is training. Because in trying to make services available, we cannot depend on potentially small numbers of ENTs and audiologists. We really need to train primary level health workforce. We need to train health workers in countries, or primary level physicians, doctors, to be able to do some steps. I'm not saying that they're going to be implanting patients, but they need to become also our advocates, and also be able to provide services in the community, so that we have this balanced approach. We create a demand and we provide services, and that is when our field would start growing.
Well, thank you very much, Shelley. I was missing the word training up till now. Mario, what do you want to know?
Thank you, Javier. I fully agree with Ranjit and Shelley, and of course, Professor Bengalem. But in my opinion, from my point of view, because, you know, I lost the Aladdin's lamp. Therefore, we need to concrete. To concrete, we have an excellent organization called Hearing. Hearing is a tool to education, to awareness, and to training. This is the three pillars, in my opinion, have a comprehensive approach to the problem of hearing loss and ear disorder. Therefore, we need education to non-ENT colleagues, because non-ENT colleagues don't know this problem. And it is another pandemic situation, not only infection. This is another pandemic situation. The second is awareness to the social agents and non-governmental organizations. And the third is the training of ENT doctors, especially audiologists and surgeons, to provide the services. In my opinion, we have a good tool to do it.
Great. Gunesh, I was going to go with you, because I would like to move a little bit from what we're dealing now to the role of hearing as a group, like any other group involved in hearing care, not just us, but we can talk about us, because this is the experience we have. What can you tell us?
Now, I just want to add to what everyone said. Totally, awareness is crucial. I think we can learn from another disability which has shown us how effective awareness can be, and that's blindness. Here, not being able to see. And we see how much awareness has created in that area, pervaded all through society. And more importantly, it had, how to get on the political agenda. The key is to get hearing loss, hearing care onto the political agenda. And obviously you asked about a very practical how to do that. Election times, pre-election times are the best times to try and push for changes. From my own experience, we have learned that these are, politics is crucial, and to implement that, to get the momentum. Obviously, awareness is much slower, but it's just, let's say, a way of speeding up things. And I guess the agenda should be also, as you said, in the education. So in the kindergarten textbook, you should have a story talking not only about blindness, but also a story talking about deafness and hearing loss to the kids, or at primary school level. So you see, I think there, I guess awareness, and that's what everyone said, in various dimensions has to be really much higher, and that's where we all can contribute as we as hearing health advocates or hearing health professionals. Yeah.
Okay, there's something that it's a big concern in high-income countries, and I don't know if you can. I mean, you, Professor Rajan, you can just mention something about hearing loss and cognitive decline. Do you think cochlear implants may solve dementia?
Well, I don't think it'll solve it, but it can certainly, have a big. We are learning that treating hearing loss in the elderly has multiple effects. One's on cognition, one's on their mood. So depression disorder, dysphoria, all these things. The positive effects of treating hearing loss on that big, population. And obviously, in high income countries, usually, the population demographics are such that the elderly population, the fraction is increasing. So it's not a population pyramid anymore. It's a mushroom with a big quantity of elderly people. So I think in order to keep these big population or to re-socialize them, keep them active in the society, we have to take hearing loss serious and treat it quite aggressively. I think that's what we are learning from research, that hearing loss in the elderly has such an impact, dementia, depression, all these aspects. And I think that's also something to put on the agenda, because the impact of this large elderly population cannot be denied in the high income countries. Yeah.
Okay, Shelley, you owe me a wish. Go ahead.
So I just wanted to highlight in support of what Gunesh just said, that the Lancet Commission on Dementia highlighted that adult hearing loss is the most common modifiable risk factor for dementia. And this was published in 2020. I'm sure most people had seen it. So that is a very important piece of work, because it gives us a very good weapon in our armamentarium for advocacy, of course. But I would just like to qualify this here, your question, Professor Gavilan, to say that it is hearing care which can certainly reduce the onset or delay the onset of dementia. I wouldn't limit it only to cochlear implants. So just to say that.
Okay, and your wish, your second wish?
So my second wish is that we would all work together to come up with strategies to address the stigma which is related to hearing loss. So I think that was already mentioned by Ranjit and maybe by others as well. But we really think that in a visual way, it is that it somehow ring binds us, irrespective of how much advance we make in technology, in clinical service provision. As long as stigma is there, even in countries where hearing aids, for example, and implants are completely free of cost, we see that people delay their hearing, getting a hearing aid by as much as 7 to 10 years. So that's a huge period of time. And the reason for that, one of the reasons for that certainly is the stigma which is associated with hearing loss and the use of hearing technology. And this is something which is, I think, beyond the realm of just us here. We need to take a much broader societal perspective. So my second wish would be for us to really develop that societal perspective and be able to address this issue of stigma across the board.
Okay, Ranjit, you want to say something?
Yeah. First, I would like to add what Gunesh said, I mean, in a different perspective, because this is for the rest of the 400 plus people who are watching, who wants to go on that work. I think the way you put things is very important. So we know that hearing loss is one of the major contributors for dementia. Right? We know that, but that's not the only contributor. But yet, that's the only contributor which can be restored. Okay, so that's the message that they have to convey. The way you put things is very important to really have to convince someone. So though there are multiple factors that can contribute to dementia, but hearing is one factor which can be rectified. So that's, the way that you can, that helps, that gives a little mileage, because personally it has given a lot of mileage convincing many people going for cochlear implants and hearing aids, making that statement. And the second thing to add on to what Shelley said now is removing the social stigma. So one thing that worked very well for us is the patient advocacy group. That's the best way to eliminate the stigmas. That has really worked out very well for us. Thing is, we have to make the hearing aids or a cochlear implant as a fashion statement. So wearing glasses is a fashion statement today. I wear Gucci glasses, I wear Prada glasses, but we only have, we don't have any designer cochlear implants or something. We really have to make this cochlear implant as a fashion statement. We really need to put it in such a way that this is not a piece of device which is going to expose your disability. This is a piece of device that's going to elevate you to a different level if you have the problem, So, and sooner it will happen owing to a lot of technologies that is going to be incorporated with the hearing devices and those things. I think it'll come into play. So,
okay, good, Ranjit. Thank you very much. Hamid, you wanted to say something about stigma?
Yes.
It was another word missing up till now.
Not about stigma. I was talking about stigma in our civilization, our society. The time is running, and I'm afraid to not be able to ask a question that perhaps you will ask about it. I suppose that I resolve all the problems regarding, as said Mario, education, awareness, training, advocacy, resolving the problem of stigma. And I promise that I resolve all these problems. But the financial problem, the cost of hearing aid and cochlear implant, how can we try to help not only the low income population, but all the users? And my question is very direct, perhaps it's shocking. How can the firms, the companies who are involved to produce hearing aid and cochlear implants can help the user, the professional, the insurance, the government to reduce the costs of the devices? And Professor Shelley said the journey for 2050. What is the future of the cost of these devices? Is there any evolution, decreasing of the cost, increasing of the performance? what is the future and how can the firms, the companies help us?
Wow, you open the thunderstorm
The
box.
thunderstorm.
Well, I think we should have someone from a company here to answer that question. I don't know if some of you want to say something. Yes, Gunesh, go ahead.
I think there's a good example. You know, if you compare just very practical hearing aids versus implants, obviously hearing aids is done in the millions, produced in the millions. So the moment a product gets into that scale, you can bring in new processes to make it very cheap, etc., etc. So I think I read the other day that doing producing a high-tech hearing aid. I don't know which company, but it doesn't really matter. It costs around $10 to $30, right? And it gets sold in the shops or by the acoustic, by the audiologist for $2,000, $3,000. So you see, there's a big margin in between. And I think for the implant, it's not there yet because the numbers of the implant, as you know, they are in the thousands and not in the millions. I guess for the implants, I guess they're not scalable yet, for mass production. But I just want to, add something brief. The financial side obviously is very crucial. The financial agenda, because that's how you force things. If it's costly, if something costs, people try to reduce costs, and that's how you can also force things. And I think there, as Shelley showed, we had to point out that prevention is something very crucial for deafness and hearing loss in the developing countries. So where 60 to 70% of the hearing loss is preventable. If you have vaccination programs against measles, mumps, rubella, so there's ways. But I think you highlighted a good point that the financial pressure can also work towards promoting the impact of hearing loss.
And how is research impacting this? How is research playing a role in the price of things we are using today? Because it's not just the price of producing I'm just asking, it's not the price of just producing a hearing aid. It's just to develop the next hearing aid, what puts money there. I don't know if this is a reason, or do you think there is no reason for so high prices, or what do you think? Suela.
To tell the truth, I don't know how we can do it, because we don't have any Albanian kind of industry for producing that. So always we have to order from abroad, and we tried a lot with private financing to ask them for donation, but I don't know if we can how we can work with that. So
Ranjit,
no ideas on that.
Go ahead, Ranjit.
Well, the price cost is something which is very important. Thanks for bringing this topic. But if you look at the cost, it's not the cost for the manufacturing alone. There's a lot of additional cost which is added to it. We really need to do an audit to see where we can do the cost cutting. And the cost cutting depends on the country and the service delivery model. So that's something very important. The service delivery model goes hand in hand with the cost of the whole device that we're going to use, whether it's a hearing aid or a cochlear implant. And the second most important thing which I want to highlight here, it is not the cost of the device, it is the maintenance of the hearing. So one is buying a device to intervene, to restore hearing. Another one is maintaining hearing for lifetime. That's a huge cost. I think that is something which we really need to consider if the device use has to be very sustainable for them. And some insurance companies in India, for example, if you take the state-funded programs here, my state is refunding the accessories, then one more state is refunding the accessories. But how long? But most of the other people, that becomes the biggest burden for a developing country, maintaining the thing. So I don't know whether it's feasible. I think it's a very big idea. Maybe I can just throw something for the industrial people, if there's somebody's watching, maybe they can do the cost cutting by associating with the local industry partners in the respective region to manufacture some of the basic components that can bring down the cost on maintaining and the other things. So that's one thing that comes to my mind. And apart from that, we really have to look at the cost-cutting factors in many angles.
Okay, you may not believe it, but time is almost over. I have like 1,054,000 more questions to have you asking, but we will not have time for that. So unless you want to say something very briefly, some of you, I would like to summarize more or less what we are been discussing here today. I think more than a summary, I would like to make a plan of action. Why do we need an action plan? Well, because the only action concerning hearing care that we cannot take is taking no action. So we have to do something. You have said a lot of wonderful ideas, but I think there are two words that come to me as the main action that all of us must do tomorrow morning. One is awareness, and the other is training. We have to clearly define the training needs and the procedures specific to all kind of hearing implants and to all kind of hearing care for disabled hearing patients. In my opinion, it's crucial, and you have agree with that, it's crucial to increase the awareness with funding agencies and ministries of health. This may sound very political, but it's the truth. And if we go there and get the money there, we will be able to improve the situation. A single word for us as hearing group, a group of excellence in the hearing implant world, we should promote awareness, and we have been doing this with our quality standards published before in scientific journals, and we should act as facilitators for the creation of high-level hearing implant programs. Another issue that comes to my mind as a crucial conclusion of this discussion is resources. It's another word that comes to my mind. And we have to create efficient referral pathways. Remember Professor Chadha saying that we have to promote new hearing care models to be conducted close to home, because I think it's time to bring care to the patient instead of taking the patient to the care. And this is very important if we want to improve in hearing care. Hearing screening, we're all aware of the need for neonatal hearing screening, but maybe we should move one step forward and establish the idea of neuro-linguistic urgency in children to promote the awareness of the impact of hearing loss in children. And of course, when possible, create awareness about the impact of hearing loss in adults and promote the need to develop hearing screening programs for older adults. And finally, we have to expand indications, something that maybe has not been covered. It's not the goal of the WHO report. Things like bilateral cochlear implant or single-sided deafness treatment, or lower the barrier to hearing implants and make it inclusion instead of disability. Try to move from disability to participation, and try to find a way to motivate the healthcare system to increase budgets for implantable treatment options and how to integrate ear and hearing care into the national health plans. This is in a more political level, but this is very important because, as Shelley mentioned, we have to create awareness of the cost of not treatment. And this is only cost. This is the only cost we cannot afford. This is the cost of doing nothing. So Thank you very much for being there. Thank you very much for this lively and appealing discussion. And right now, I would like to call the chairman of the hearing group to stage to join us. And let me just show you the web page of hearing. All of you, if you want to send us questions, doubts, suggestions, please contact us. You will have always some of the 31 hearing center members of hearing that will be very pleased to answer your questions or to reply to your comments. I would like to also address the new roundtables that we will have in the future. We are having this as an extraordinary roundtable from the hearing group. We had a spring roundtable on unilateral deafness of SSD that was last spring. In a bit more than a month, we have another roundtable with the topic to be defined, and we'll have a fall and winter roundtables. Please join us. It will be a pleasure to have all of you here. And I just want to thank all the panelists for their participation. I would like to especially thank Professor Chadha for giving us such a good insight in the problem. And I would like to, of course, thank the more than 400 people that have been at the other side of the webcam. I hope we can be at the other side of the table in the near future, face to face, when this pandemic comes to an end. Thank you very much.
Thank you. Thank you very much.
Thank you. Thank you, Juan, and to all the participants.
Thanks.
Dear Professor Gavilan, dear Javier, thank you very much. Thank you to the wonderful audience of 415 participants. It was a super, super interesting discussion. We should not forget, we are one world. We are one world standing together, not only in COVID. We need to stand together in hearing impairment. We want to fight hearing impairment together. We want to overcome it. And this was really a perfect motivation. Really, my special thanks to Professor Salavaci. I had already from Albania a few doctors here in Vienna in our department at the University Clinic. I hope, they are doing well now in Tirana. Really, my very special thanks to Professor Bengalem. I met him last time, it's 2-3 years ago when we met in Dubai. It's unbelievable.
Yeah,
and maybe one day the IFOS will be in Casablanca. But on the other hand, you were very lucky not to got it this time because of the disease.
Absolutely.
And really, my super special thanks, and I think it was really important, to Dr. Shelley Chadha from the WHO, because in my opinion, we need to tighten our relations. So the WHO can help us in our departments out in the front of the daily life. And on the other hand, also we as hearing and the group out, the people, what we do every day scientifically, I think we also need to work a little bit politically, not only for the awareness, also for the hard facts, what to do. And really, for me, this is a big motivation to seek some connection with her and also for the WHO. So I want to thank all of you, all the hearing members, all the audience. Thank you very much. As Professor Gavilan mentioned, our next summer meeting, 24th of June. Please don't miss it. We have a very special thing. I think we will celebrate 25 years of Vibrant Soundbridge. It was exactly 25 years, and we will have a super surprising special guest. And now we need to think what we have just discussed. And I want to thank you very much here from Vienna, and I hope to see all of you in 6 weeks on the 24th of June. Thank you very much, and goodbye.
Thanks, everybody.
Thank you.
Thanks.
Take care. Stay safe. Stay
It was a
healthy.
pleasure. Thanks,
Thank
Javier.
you.
Goodbye.
Thank you.
Bye bye,
Bye
Shiri.
to
Thank
all.
you, guys.
And I still have
Ciao, ciao.
one wish pending, Dr. Gavilan.
Yes,
Yes,
yes.
you
We
still
were waiting
you
for the
still
third
have
wish.
you still have a wish.
Please.
So I shall encash that at a later date. I'll keep it with me.
Okay. Next,
Okay.
we have a reason for another meeting. You have to give us your last wish.
Certainly. Yeah. Thank you very much for this opportunity. I really enjoyed it.
Thank you for coming.
Bye bye. Thanks, Shiri.